Hello and welcome to our Friday webinar. We're on with Dr. Lamb. Welcome, Dr. Lamb.
Hello.
Hi, and we got, sorry, I can't stop giggling because behind you, now she's wearing some bloomers here. You want to, we have, well, of course, I guess this is a hint on what our topic is today.
Yes.
We're talking about chickens and all about chickens, as well as chickens and keeping chickens and parrots, how that interacts. There we go.
Yeah.
Nice.
Now she looks more like a chicken.
You definitely, yes. Wow, okay. This is awesome. I don't think we've ever had chicken before in our webinar. So we've had, gray, you've had your gray, we've had Arroyo, we've had Marine, and now we have your chicken. This is great.
Yep.
I love it.
Now we've had my finches. My finches have joined before.
That's right. That is right. Okay. All right. So if you're just joining us, yes, we are talking about chickens today. Oh, I'm not. Dr. Lamb is. And I'm going to guess you have a fabulous presentation for us, like a PowerPoint. Are you doing a PowerPoint?
Yep, I have a PowerPoint for us today.
Okay.
And if you're ready, I can share my screen.
All right. Let's see. Oh man, I wish we could have your chicken as like a little inset photo to this, because that would be
right, just her.
Yes. Well, so wait, what is her favorite? What is she? What's a treat, a snack that are you gonna get into your presentation?
Yeah, so I mean, right now she's I gave her a snack to keep her occupied up on the exam table here. She's a pretty good chicken, and her name's Artemis. And she is pretty tolerant and does a lot of things that I ask her to do. But I don't know how much she's gonna want to sit up on the exam table the whole time. We'll see. So I gave her a snack to maybe encourage her to stay up there. And that's a Nutriberry actually that I broke into a bunch of little pieces for her to have fun pecking at for a while. And since it's on the towel, some of the little seeds are getting in between the.
Ah, gotcha. Something tells me that a chicken is a perfect thing, a perfect companion to have around when you drop crumbs on, when if you're a messy eater.
Absolutely. Yep. They definitely will clean up after you, that's for sure.
All right. I'm gonna let you I'm gonna let you take it away. I cannot wait to learn about chickens and yeah.
All right. Let me go ahead and share my screen here. All right. So, as we've already mentioned, today's topic is about chickens and parrots. And it's a topic that I think is fun to discuss because a lot of parrot owners that I've met have chickens as well. It's almost like one of the birds is a gateway into the other bird. Sometimes it's that you have the parrot owners who think, oh, it'd be kind of fun to have some chickens in the backyard, and they go get chickens. Or it's the other way around, where sometimes people have chickens and then they're like, hey, I want a bird that lives inside, and end up getting a parrot of some sort. So I have a lot of clients who have mixed groups of birds in their homes, and so I thought it'd be interesting to talk about it today, so that one, we can learn more about chickens, because chickens are definitely some pretty cool companion pets, but then also so that we can kind of understand some of the problems that could come about, because there's many times you'll hear that you don't have chickens and you don't have parrots together, two species that you should totally keep separate. Whoop. Down here. All right. Well, maybe that won't work as well. She can hang out with me right here. That'll work for the moment. So let's get into it. So just to start off, as I was mentioning, chickens are really great companions. People often get chickens initially as sort of like a utilitarian thing. A lot of times people say, well, I want to know more where my food is coming from. I like eggs. I can get some chickens and have fresh eggs daily available to me. I don't have to go to the store and buy those eggs. I can have those birds laying for me in the backyard. And so that's often how people first get them, is that desire to have that fresh daily egg. But then a lot of times what happens is when people have these birds as, pets or birds in their backyard, a lot of times they start to recognize that these birds actually have some pretty cool personalities, are pretty unique in their own ways, and they start to really turn into a pet as opposed to just this animal that's working for you in your backyard. So there's lots of great things that they do as well, aside from just being a really cool companion. They help control insect pests because they are constantly pecking around and trying to find different things to eat. They love to eat like most animals, but they will control some insects. If you have any insects in your backyard, they will absolutely take advantage of those situations. They also can produce fresh manure for people who like to do gardening. Their feces can be a great part of a compost to spread out into your garden and acts as a little bit of a fertilizer. So there's many things that are great about them and really helpful for us. But at the end of the day, a lot of them actually turn into pets. And it's really funny because a lot of times when I have an owner bring me a chicken, almost half the time an owner brings me a chicken, they say to me, I must be the only person who brings my chicken in. And they feel a little ashamed sometimes, I think, like, oh, why take the chicken to the vet? To which I then usually tell them, no, we see lots of chickens here, lots of chicken owners love their chickens just as much as they love their other pets, and good for you for bringing them in to get care and everything, because it shows that you really care about your pets and want to keep them healthy. Now, the first thing that I really wanted to get into is more from the chicken side of interesting things that we see medical wise with chickens. And this is actually some data that I had compiled from our hospital, where we see an average. Originally, I actually had looked at our data several years ago, and we actually only averaged at that point about 3 chickens a day. I thought we actually saw 3 chickens a week. I had thought we had seen way more chickens than that. To me, I was like, oh, that seems weird that we only see 3 chickens a week. Well, that was data that I had gotten together back in, I think, 2018. And this last year had looked at the data again to see like how many chickens are we seeing now compared to 2018. And now we average 1 chicken a day at the hospital. So, and that's amongst all the hospitals, because the hospital where I work, we have multiple locations. And so it's like a chicken per day per location is what we average. So sometimes we don't have any chickens a day. Sometimes we have like 3 chickens in a day. It just depends, right? But when we look at what the chickens are often coming in for, I try to categorize it as well as to like, what are the common problems that we actually see? So first most common thing that we actually see, I put under the integument system, which is going to be our skin. So things like some sort of trauma that happened to the bird where they have cuts, lacerations, or a common problem, bumblefoot. Mites is another thing, or lice will commonly see them for. The second most common problem is problems associated with the gastrointestinal tract. So certain like infections in the GI tract, parasites, chickens eating silly things that they're not supposed to, and getting foreign bodies, or sometimes, anorexia, they're just not eating the way that they should be. The third most common thing, and I really thought this was actually going to be higher on the list when I originally compiled all the data, but reproductive disorders. If you would have asked me before I pulled all this data together, I would have told you that reproductive disorders were number 1 or number 2, but it turns out it's actually number 3 as the most common thing that we will see. And so there's just a variety of reproductive problems that we do see in chickens, similar to like what we've talked about in our other companion birds, our parrots, how we see a lot of reproductive and hormonal related issues with them. We do see similar things in our chickens, but even a little bit more in our chickens, because our chickens really are designed to always be laying, right? So we have bred them over the centuries to be able to lay a lot of eggs, which is great for us, but sometimes it's a bit of a strain on the bird. And so we see various reproductive related problems associated with just the lives of these birds, and the fact that they can lay so much. Neurologic problems, respiratory, we do see chickens for wellnesses too. Believe it or not, there are people who come in for wellness exams on their chickens, which I think is awesome. I love to see patients for wellness exams. The reality is the vast majority of the patients that I see tend to be ill in some way, but we do wellness visits, and I encourage people to do wellness visits on all their animals. It's a great opportunity to learn more about the animal and make sure that we're doing everything right by them. Make sure that we're not potentially doing something that could, maybe it isn't a problem right now, but maybe a problem later. And also looking to try to catch problems early. So, and in the case of chickens, there are certain vaccines that can be done for certain disorders and diseases. So, that can be beneficial for them. But to highlight a little bit more of the more common things that people will bring birds in for, I wanted to go over that sort of stuff next. So the first problem I wanted to talk about is something called crop stasis. And crop stasis is a real common problem. It would fall under that gastrointestinal tract problem in my list of categories that I had mentioned initially. What the crop is, I have this picture here of this anatomy picture of a chicken. And it's kind of showing all the internal organs and everything of the chicken. And in particular, what we want to pay attention to is this organ right here that is labeled, as you can see, the crop. So the crop is this dilation of the esophagus, and it's a sort of lower portion of the esophagus that's dilated. And it's a dilation that can hold food before it goes down into the lower portions of the gastrointestinal tract, including the proventriculus, the ventriculus, and then further on down throughout the loops of the intestines. Food is sort of stored there a little bit in order for them to be able to eat a lot of food quickly, kind of have it sitting there, and then it'll just slowly move its way down. Problem is sometimes that crop doesn't move the way it's supposed to. And if it's having poor motility, then you can get this problem called crop stasis. The word stasis makes sense. Stasis means something isn't moving. So what isn't moving? The crop isn't moving. And you're just not getting food passing down into the GI tract the way that you're supposed to. So what you end up seeing is this large sort of pendulous soft crop. It can sometimes be soft, but sometimes it can be firm. It depends on what's in there and why it's distended. And sometimes these birds come in with weight loss despite having a good appetite. So they may be seeming to be eating fine. Sometimes owners will even say that they are eating more than normal. They're really ravenous and wanting to eat a lot, but they're losing weight. And it can be a really variable length of time how long a bird is having problems with crop stasis by the time that they present. Sometimes we have birds that the owners notice it rather quickly that there's a problem, and maybe they've only been dealing with a problem for a day or two, and then other times where the birds are, they've been managing with this for a couple of months before the owners recognize that there's a problem. There's lots of different causes for crop stasis. I just put a few of them here. We can have infectious diseases like bacterial, fungal infections, parasitic infections, viral infections will sometimes cause crop stasis as well. In particular, there's a common virus called Marek's disease. It's a herpes virus. It's pretty ubiquitous across the nation, and it's something that when a bird gets it, it can affect the nerves that are leading to the crop, making it so that they don't empty the crop the way they should, and you get this problem. But you're gonna have also silly things like an impaction within the gastrointestinal tract. So sometimes, as I had mentioned before, sometimes chickens eat things they're not supposed to. And even sometimes things that are okay for them to eat still can cause an impaction. For example, grass is something. Chickens can eat grass. It's fine for them to do. But if you eat too much, then you can have a problem and you can get an impaction in the crop because of a grass being too much sitting in there and just clogs things up. I've also had birds inappropriately eat sand when they've been on some sandy substrate. They just sometimes peck at silly things. As far as foreign bodies go, foreign bodies, again, could be things like grass, it could be sand, but it could also be really weird inanimate objects. I have chickens that have eaten pieces of metal, pieces of glass. I had a chicken that ate a watch battery. I mean, it's just sometimes the weirdest, silliest things that you'd be like, why would you eat that bird? But they like to peck at things. They're pretty inquisitive, and they definitely don't really always make the right decisions when it comes to swallowing things. So toxins can also cause crop stasis. If we have a bird that gets lead toxicity, that can really cause some nerve problems and lead to slow motility. Metabolic disorders like liver problems or kidney problems can cause it. Trauma is something that can cause it too. If there's been some sort of trauma that happens, or burns, if there's some sort of burn to the crop tissue, that could slow things down. And then sometimes nutritional causes. We don't see a lot of nutritional causes. And then other times too, sometimes it's something completely unassociated with the gastrointestinal tract. For example, just earlier this week, I had seen a bird that had crop stasis as its presenting problem, but it turns out that they actually had an underlying reproductive tract problem that was making them feel ill. And then because they were ill because of that reproductive tract problem, then they get this secondary crop stasis problem. So super common. The problem is there's a ton of different things that can cause it, so it's not a straightforward issue. So because it's not a straightforward issue, I can't tell you one simple, easy treatment that we do for these birds. You really have to treat whatever the underlying cause is to truly resolve it. If they have an impaction with some foreign object, okay, that needs to come out. If they have lead toxicity, we need to treat the lead toxicity. If they've got a bacterial or a fungal infection or a parasitic infection, we can treat those with antibiotics, antifungals, antiparasitics. Now, if they have something like Merrick's disease, that's going to be a little bit harder for us to treat because Merrick's disease is a virus. We really can't get rid of that virus. And so unfortunately, when birds present with crop stasis associated with Merrick's disease, that one, sometimes we're having to, unfortunately, look at humane euthanasia because usually those birds are going to be slowly getting worse, having other problems. And, you know, when we have this poor motility to the crop and we're not moving things down into the lower gastrointestinal tract, well, sadly, those birds aren't getting the nutrition that they need. If they're not getting the nutrition that they need, they start to waste away. And so we don't want to, if we have something serious like Merrick's disease causing this problem, we don't want to prolong any suffering that can happen. And so sometimes humane euthanasia is necessary. As I mentioned, I had a bird earlier in the week that had crop stasis and associated with reproductive problems. We need to address the reproductive disorders, you know, so again, whatever the underlying reason is, we try to fix that in order to truly resolve the crop stasis. But there's usually supportive care that goes along with treating the crop stasis. So we may be doing massage where we actually kind of massage the crop and try to encourage things to move lower down in the GI tract. There actually are crop bras that are created. So like this picture here is actually Artemis. And she was okay. She had just eaten a very large meal. So she had packed her crop full of food. So you can see how like pendulous and like fat she kind of looks right there on the front of her chest where that crop is. Now, if you see the crop being big for a moment and then it resolves itself within an hour or so, that's normal. The bird probably just ate more than it should have, was a little gluttonous and it moves and everything's okay. But if it stays like this, over a prolonged period of time, okay, that's abnormal. That's something we need to check out. So Artemis was okay in this image. I just thought it was a great snapshot to show what a big crop can look like. But people do actually make crop bras where it's like this little like flap of material essentially that you can put over the crop, and it straps up around the back. And so it keeps that crop kind of pushed down more so that when they are eating food, there's not as much ability for that crop to fill up. Stuff has to pass down the esophagus and go into the lower portions of the gastrointestinal tract to get where it needs to be. Sometimes people will use mineral oil. Mineral oil, you know, I say plus or minus on that because it just kind of depends on what's going on as to whether or not it's going to work. And sometimes, you know, I've had people do it and it's actually been a little bit more of a problem because then sometimes they fill the crop up with mineral oil and it's going to help when you have something like an impaction in there possibly because that mineral oil acts as a laxative and it may help some things that are impacted within the crop move through. So if you have like a grass impaction or a sand impaction, it might be helpful there. But if you're having poor motility of the crop because you have something like lead toxicity, mineral oil isn't really going to help. Because now you just filled the crop up with a ton of mineral oil. And one of the risks associated with having this problem is they can regurgitate. And if they regurgitate, they could aspirate. So you can have a whole bunch of problems. So I put plus or minus because it is something that people do, but it's definitely not something I generally am recommending people do without having the bird looked at. I also put pro-motility agents. There are medications that actually can be given that will stimulate that crop to move in a normal way. Moving on to the next issue with chickens, I wanted to talk about lead toxicity. Now, lead toxicity, I put it as very common, with the caveat being that it depends on where you are as to how common it actually is. When I lived out on the East Coast, when I lived in California, I actually saw a lot more lead toxicity cases than I do see now where I live in Arizona. There's just a little bit less contamination, I think, of lead in the environment. And remember that birds are pecking around, our backyard chickens, if they're hanging out in the backyard, they peck around, they kick up the dirt, and you may think that there's nothing in your backyard. But also at the same time, I mean, stuff gets buried in the dirt and can live under, or I shouldn't say live. So inanimate objects can be underground, under the dirt, under grass and bushes and trees and what have you. And you can be completely unaware of what's actually hidden in the dirt under the ground. And chickens, what do? They go around and they kick up the dirt, and they just pick at things in the ground. And they love to pick up shiny objects, as emphasized by this chicken here. This is an X-ray of a chicken. Her head's up at the top, her tail's down at the bottom, and her wings are kind of pulled back. You can see all this bright stuff in the stomach portion. This is the gizzard of the chicken. And look at this thing, like that's a screw. Like you can tell that that is a screw inside the chicken. Is a chicken supposed to have a screw inside of it? No, it's not. You can see all these other little like weird wires and things too. Now, some of that stuff that's bright, but not as bright as this screw here, some of that's just mineral density. So it is like little pieces of grit and gravel. But these areas that are a lot brighter, those bright things are metal densities on an X-ray. And when we see metal densities, we worry, could that metal have lead in it? And certainly there's things that aren't supposed to have any lead in it. Like your screws are supposed to be stainless steel. So this probably wasn't causing any sort of lead toxicity, but these other little bright things here, those very well could have been things that had lead associated with them in some way, depending upon what that metal actually is. And I can't tell you what it is just looking at. I can just tell you if there's some metal opacity in there, and I might be worried about lead toxicity when I see little things like that and want to check blood work on them to see if they do in fact have lead toxicity. The signs that it causes, well, one of the things it causes is crop stasis, so what we just talked about, but it can also cause a lot of other neurologic problems. It can cause seizure activity. It can cause them to have like just hind limb weakness. So maybe they're like kind of not able to move those hind limbs at all. They seem very bright and alert, but they're not able to stand up and support themselves. They may just be generalized weakness. They may just be all over, just kind of flat, not able to move, like not even wanting to lift their head. They may just be a little quiet, or the most frustrating time is when they have no signs at all. So they're not even like exhibiting anything as a problem, but they have lead toxicity going on and they're acting like everything's fine. In order to diagnose it, we take radiographs like you can see in this image here, but then we also run lead levels to see if they have lead in their blood. Now, usually when we're treating lead toxicity, we have to sometimes do both medical and surgical management. Medical management is where we're actually giving them chelating agents. These are things that are either an injection that you give the bird or an oral medication that you give the bird that helps bind up that lead that's in the blood and helps them excrete it. It actually gets excreted out through their kidneys and passes out in the droppings. But if you have that's the lead that's like in the blood, in the body's circulation. If you have an object, like we saw on the last pictures, that was some metal opacity hanging out in the GI tract, you got to get that out of the GI tract. And so there's various ways we can remove things from the GI tract. Sometimes we can do like endoscopy, where we actually put a scope down into the stomach and we can kind of like flush things out. Sometimes that's not going to work and we have to actually open them up. This is a picture here of a chicken in surgery that we actually had to open the stomach, and we pulled this wire out of the stomach. This chicken did have lead toxicity. Whatever this little weird wire was, it actually penetrated through the stomach of this bird. This bird was extremely lucky. Not only did it have lead toxicity from this thing, but that nail or whatever it was, that wire penetrated through the GI tract and actually caused the body tried to wall it off and it caused an abscess around it. So I had to remove the abscess that was on the stomach wall, remove the little wire, clean everything up. I mean, you can look at how awful this is. This all this like black gunk, like that's not supposed to be there. That's definitely not healthy tissue. All this stuff had to be cleaned, and the bird had to get chelation therapy to resolve the lead toxicity in circulation. Now, I think this is a really important topic to discuss because lead is actually something when a chicken has lead toxicity, that lead can actually get into their eggs. And so if you have a chicken with lead toxicity, please do not eat their eggs, because you can then get lead toxicity from eating your chicken's eggs who had lead toxicity. So it is a human health risk. Now you can actually send eggs to the California Animal Health and Food Safety Lab to actually measure the level of lead that's present in the albumin, the yolk, or the egg shell, to know if you've got lead toxicity. Now, interestingly, there's a study that does show when you chelate a bird, so again, that's when you give them the medication that helps them bind that lead out of their blood, and help them get rid of it from their blood and from circulation. Then when they go on to continue to lay those subsequent eggs, in that particular incident in that study, that bird no longer had lead identified in them. So chelating the chicken can help maybe reduce lead in the eggs too. However, that is based off of one single chicken. And so that isn't something that we can say with real strong evidence to say, oh yeah, you just need to, if your chicken has lead toxicity, you need to chelate it. It's going to totally resolve this chicken from ever having any lead pass through in its eggs. You think that might be the case, but we don't have a really solid data to truly say that. And so at this point, we just say, don't even eat the eggs at all. If you have a chicken who had lead toxicity at any point in its life, even if it's doing better, do not eat its eggs. We don't want people out there getting lead toxicity. Now to go into what I think is probably the more common thing, or I feel like it's the most common thing. But again, my data supports that I am wrong about the way that I feel, that in fact, this is the third most common thing that I'm seeing them for, is reproductive disorders. Again, there's lots of different reproductive problems that we can see birds for. But one of the common things is going to be egg binding. And so just like we've talked about in the past with parrots, there's various causes of egg binding. We can have something where there's a problem in the oviduct itself. So the oviduct is the portion of the reproductive tract where the yolk moves down. So you have your ovary and your oviduct. The yolk comes off of the ovary, goes down the oviduct, gets different layers of the shell formed around it, and then you have your egg. So if there's something wrong with that oviduct, such as there's like a cyst in there, or some sort of torsion, or impaction, or cancer, that may make it so that they don't pass eggs through the way they're supposed to, and you can get some pathology. Nutritional causes are going to be things like low calcium levels or low levels of vitamin D. One of the problems I have experienced is, most people it's easy to buy just chicken food and feed your chicken food. So we don't see a lot of low calcium issues, but what we do see more frequently is probably low vitamin D levels, because when we have chickens who live inside, who are not outdoor chickens, they're not getting exposed to UV light. If you're not exposed to UV light, you don't make as much you really don't make vitamin D. So you're purely dependent upon it in your diet. But that might not really be enough. Chickens really should be outside and should have exposure to UVB lighting, and if they don't, then they may not have enough vitamin D. If you don't have enough vitamin D, you don't absorb calcium as well from your gastrointestinal tract. If you don't absorb calcium well from your gastrointestinal tract, you don't have enough calcium to lay eggs, form that shell around the egg, and have the egg pass through the reproductive tract the way it's supposed to. So I have had some owners who have their chickens strictly indoors, who are purely pets and nothing more, have problems with this, probably because they're inside more than they should be and not being exposed to UVB radiation, whether that be through being outside in the sun or having a light, a UVB light. Sometimes just the excessive egg production, because again, these chickens are constantly laying. Sometimes that leads to egg binding problems. Sometimes they have odd malformed eggs, as you saw in, let me go back actually, this picture here. These two eggs are different sizes. This came from the same bird. The one that's smaller is not normal whatsoever. That egg passed through a lot more quickly than it was supposed to. So you have this really weird egg. And sometimes if you have things like that happening, well, that could potentially result in some problems with passage of the egg. And then first time layers. Sometimes the first time a bird is laying, it's a little more strain on the body. So signs that we may see with a bird who is having some egg binding issues, we may see them straining, we may see them not really wanting to eat, just being quiet, kind of fluffed. They may have lameness, and what I mean by that is like they're not using one of their limbs appropriately, they're not standing or perching appropriately. They may also have an increased respiratory effort, because when you have this big egg, like you can see in this X-ray here, where you have this big egg in the back part of the abdomen, it's this giant thing that's sitting in there that's taking up more space. And remember that birds have their lungs, and then they have their air sacs that branch off of their lungs. And those air sacs go all the way to the back part of the body. And if there's a big egg that's taking up a lot of space, it can put pressure on those air sacs. And then by putting pressure on those air sacs, maybe we're not getting as full of like a normal respiratory cycle as we're supposed to, and thus they may have some increased respiratory effort. They can also have increased respiratory effort because they're painful, because, you know, it's not always comfortable passing an egg. We will diagnose this by just maybe when we feel the abdomen. So like if I have a chicken come in and I'm like feeling its belly, I might feel a large firm circular structure. I might actually even visualize the egg, because sometimes they're trying to push that egg out and you can just see it a little bit. Or we may be taking x-rays to truly identify it. We often have to treat them with just some supportive care, giving them, you know, sometimes they need to be in an oxygen chamber if they're having any respiratory distress, maybe some heat. If they haven't been eating, some assist feeding, some fluids. If there is any tissues that are kind of getting pushed out a little bit, we may need to lubricate those tissues. We need to give them some calcium support, pain control. And if they're not passing it with all that supportive care, then sometimes we need to go on to surgeries to actually go in and remove that egg. Another common problem that we see very, very frequently in the chicken, probably more so than the parrot, is egg yolk peritonitis, or egg yolk coelomitis is the names that it goes by. Basically what happens in these situations is, as I mentioned, you have your reproductive tract, we have the ovary, and then you have the oviduct that is the tube that the yolk that's coming off of the ovary goes down. Well, that tubing, the oviduct, it's like very broad and wide at the opening where a follicle is supposed to fall into it. But sometimes that follicle, or ovum, as I have written on here, it doesn't always get caught the way that it's supposed to and go down into the oviduct the way that it's supposed to. If it doesn't get caught and it doesn't go down into the oviduct, instead it can go out into the coelomic cavity. And then that can cause a lot of inflammation and irritation. This picture here is actually of a chicken getting an ultrasound, because that's one of the diagnostics that we can do to look for this particular problem. I have the ultrasound probe on her little belly, and what I can see on my ultrasound screen here, all this black that you can see on the ultrasound image, that is fluid that is present in her coelomic cavity because of all the inflammation that an egg that was dropped inappropriately into the abdomen has induced. We may also consider doing things like taking radiographs, though I have to say ultrasound tends to be much more diagnostic for egg yolk peritonitis issues. We may take some of that fluid out and evaluate it to look at it to see if it looks consistent with an egg yolk peritonitis. We may also be doing blood work on these birds to look for any other underlying problems. What's their calcium levels like? Are there any other health issues going on that could have contributed to this problem happening? Usually what we have to do with these birds is we got to get that fluid out of there, because having all that fluid on your abdomen, that's another thing that is causing compression on your air sacs. If you got compression on your air sacs, you're not going to breathe as well. It's not going to be so comfortable for the bird. So removing that fluid. And then that word that I have written up there, coelomocentesis, that is the removal of fluid from the coelomic cavity of a bird. So, and the coelomic cavity is like the abdominal cavity of a bird. Just slightly different terminology a little bit. We may, I said plus or minus antibiotics. There's old data that shows that sometimes these egg yolk peritonitis issues are associated with a infection, and absolutely there are times when that does happen, way more in the chicken than it does in the parrot. But even in chickens, I would say there's a good portion of the time that it doesn't actually have any sort of infectious component to it, and antibiotics are not necessary. And we you know, veterinarians have gotten over time much more stingy about giving out antibiotics because of antibiotic resistance issues. We don't want to, what we have found is that antibiotic resistance is a problem. You may have used to be able to use some antibiotic and it worked really well to treat some particular infection, but now that infection has gained resistance to that antibiotic and is no longer able to be used to treat that infection. So people don't give antibiotics out as rapidly as they used to, not because they want to cause problems. It's not that at all. It's because, well, it's not because they want to cause any problems for the animal, I should say. It's because they don't want to cause antibiotic resistance problems that could result in bigger problems later on down the road, not only for the animals, but for humans and the world, really. So I don't really jump to antibiotics a lot with these guys, but in some cases it is appropriate. Anti-inflammatories may be necessary as well, because there's a lot of inflammation going on. Sometimes they need additional supportive care, fluids, assist feeding, that sort of stuff. And then I put salpingo hysterectomy is where we spay them. So this is actually a picture of, this is actually a duck, not a chicken. But these egg yolks, you can see there's like at least 3 different egg yolks clumped together here. This is a duck who had ovulated into her abdomen multiple times. All these yolks were like congealing together, were free in the abdomen, and we had to go in there and we like plucked those out. And then we also went on to spay her to prevent her from hopefully doing something like this again. All right, and then bumblefoot, another common problem. And as I mentioned, this is actually part of the integument system, which is the skin. Very common problem that we see in birds. This is where there is inflammation of the foot. That's the definition of bumblefoot. So something is causing inflammation there. There is a grading system, and there's a couple different grading systems. I use the 1 through 7 grading system because I kind of like that one a little bit better, but there's also a 1 through 5 grading system. The grading systems tell us how bad the bumblefoot actually is. So with grade 1, it's just this kind of, the skin's just a little irritated, it's a little like shiny and pink, and maybe it's like flaking and peeling a little bit. Grade 2 is a little bit worse. Now the skin's becoming pretty translucent. Grade 3 is even more worse, where now it's actually ulcerated. Grade 4 is where it's ulcerated and has a necrotic plug. And that's what this picture is here. So there's an ulceration on the bottom of the foot, and you got this gross necrotic plug plugging it up. Grade 5 is, okay, you have the ulceration, you have the necrotic plug, but now there's also swelling and inflammation surrounding the tissue. So like all around the foot is inflamed too. This chicken is lucky, it doesn't have grade 5 just yet. Grade 6 is when it goes on to involve the tendons and cause tendon damage, and grade 7 is when it goes on to cause bone damage. That's not comfortable at all for a bird, and pretty bad when that happens. So when we have birds with bumblefoot, you know, what do they present with? Well, they may have swollen feet, they may be limping. Owners may just find blood on the roosting areas. The birds may be trying to act like everything's fine, and they may really have no signs in the early stages. When we have these birds come in with bumblefoot, oftentimes we're doing diagnostics like radiographs because I want to see if there's any underlying bone involvement. If there is, I know I've got immediately a grade 7, which is the worst one. But if I don't have any bone involvement, okay, great. And radiographs can help me determine that. I might also be doing cultures in these situations because there's a variety of different infectious bacterial organisms that could be present in there that we want to know who's in there, what antibiotics are they going to be sensitive to, and that way we know which antibiotics are going to be most appropriate to put them on. Now, the treatment does vary based on the severity of the signs that are seen. So in, you know, those grade 1 through 1 and 2 cases, well, maybe we just need to adjust the perching. Now, when we get into the point where they have an ulceration, okay, maybe we need some sort of topical thing to cover the ulcer. So like this chicken here is nicely displaying his little foot wraps that he has on. And then when it gets to those really severe cases where you have necrotic plugs and a lot of inflammation, and maybe have something stuck in there, you may have to actually go in surgically and remove some of that stuff. And when it's really involving the tendons or the bones, okay, that's even more involved. And sometimes there's really involved surgeries that are a longer healing time as well for these birds. Okay, I just wanted to go over those like real common things that we see in chickens, just to guys give you an idea of what is commonly identified in our sick chickens coming into the hospital. Just a real quick plug for Lafeber's on the booster berries. The booster berries that Lafeber's has are, you know, like the Nutriberries, in that they're kind of the same sort of shape and texture and everything. But they're meant for the chickens. And they have 3 different varieties. There's the senior, the enrich, and then the radiate one. And the different ones actually have different health benefits based on what's added in them. Personally, I really like the senior one because Artemis here, my chicken, she is senior, I would say, at this point. She's almost 9 years old. In March, she'll be 9. And so what I like about the senior ones is they have some things for joint health, like the glucosamine chondroitin. They have things for cardiac health, like ginger, liver health, like dandelion and milk thistle. And then they also have, immune support things like the echinacea, which is present actually, and also the echinacea is found in all of them. So it's just kind of an immune support thing. So they have pretty nice benefits. And I have a little one here for her. Now you can see how much she loves it. I just gave it to her and she just immediately broke it into a piece and is trying to swallow the whole thing. So I'll let her hang out up there again for a moment while she eats. But because we often talk about parrots, and kind of the segue into all of this talk about chickens is, well, can I really have chickens and parrots together? And when we talk about it from a real biosecurity standpoint, there's a lot of people who will say, no, absolutely not. You cannot have chickens and parrots together. You're going to have problems if you do. And I'm a little more lax about that. Like I said, I have lots of clients that have chickens and parrots, and I mean, I have a chicken and I have parrots, and you can see in my picture here, that's Artemis hanging out with Maureen. And earlier in one of my slides, I had a picture of Artemis and Maureen together. They're actually kind of funny together. When Maureen gets on the ground and starts walking around, like Artemis and her hang out a lot. They're and Maureen, my gray there, she's 33. So she's middle-aged, I guess, or a little older. And so it's like these two older ladies just hanging out together, being friends. But it isn't appropriate in all situations. We really have to look, can these individuals live safely together? It is not appropriate in all situations for chickens and parrots to be together. There are diseases that we need to worry about. And then there's things that aren't necessarily diseases, but problems that could arise. So the questions I wanted to answer are, when it comes to can chickens and parrots live together, is, can they live together safely? What diseases do we need to worry about? And what non-infectious diseases can be an issue? So we're going to get into those things. So when we're talking about safety, there are several diseases that we have to be aware of that can transmit between chickens and parrots. First big one is influenza. And influenza is something people are hearing about in the news and have been hearing about in the news for the last couple of years, because unfortunately we have highly pathogenic H5N1 influenza in the United States. It has not gone away like it was, originally anticipated to. It's kind of been hanging out and being an issue. And unfortunately, there have been a lot of chickens that have been not only infected with it, but also had to be put to sleep to try to stop the spread. And so chickens can carry influenza, or they can contract influenza. And it is something that, you could share influenza between a chicken and a bird or parrot, so it is something that we have to be aware of influenza status in our area and maybe in our individual chickens before any sort of introduction is happening with our parrots. There's also a virus called paramyxovirus. There's a group of them. Newcastle disease is sort of the big one that is a major problem, has been in the past. And that is absolutely something parrots can pick up too, Mycoplasma, that's a bacterial infection that doesn't tend to go so much between the chickens and the parrots, but it is something that could in theory happen. Chlamydia is another bacterial infection that's kind of more of a parrot thing, but could go to chickens as well. I put parasites ? Because a lot of parasites are species specific. So we don't have to worry a ton about a lot of parasites going between chickens and parrots. But at the same time, there are some that do go between chickens and parrots. There's certain parasites that may, like the red fowl mite, likes to be on chickens more, but it can go to parrots. It is possible, Salmonella infection, so that's bacteria. Chickens are carriers of salmonella. That's just a chicken. It's part of being a chicken. And so parrots, not carriers of salmonella, And so if a chicken who's a carrier of salmonella is around a parrot, you have to be cautious about that potential for that bacteria to go from chickens to parrots. There's E. coli, and honestly, the list goes on and on and on. So there's good reason that people have been afraid to have chickens and parrots together because of all these reasons that I have listed. But I will say that, you know, you can kind of work around some things. We'll get into it a little bit more. But before we go into that, I want to go other safety things to think about, not just infectious diseases, but chickens can be sort of tough birds. And so, I mean, like, you know, you look at Artemis and she's real cute and fluffy and she lets me do a lot of stuff to her and I love her and I'm not worried about this beak causing me any injury the way I may be worried about a parrot beak causing me injury. But that being said, chickens are tough, and the pecking order is a real thing. So in the chicken world, there is a pecking order, and they usually establish dominance in this hierarchy amongst who is the top chicken and who is the lowest chicken in a group of chickens. And they like to stick within that hierarchy, and if somebody steps out of their bounds, it is not uncommon for fights to happen. And so chickens, you know, with that sort of hierarchy are different from parrots. And, you know, parrots don't have so much of that like chicken hierarchy thing going on. And so mingling them together, you could potentially be causing some problems. And I'm not necessarily suggesting people necessarily mingle them together because yes, that chickens could try to beat up parrots and then parrots and being upset could potentially bite and harm a chicken. So, you know, that has to be something that's kept in mind. Also, I think it's really important to recognize that they have kind of different housing. So avoid having chickens in parrot cages because parrot cages are not appropriate for chickens, but also avoid having parrots in chicken coops because chicken coops are not appropriate for parrots. You know, so two totally different types of housing setups are required for these guys. And, you know, a couple of reasons why. Well, parrot cages are not appropriate for chickens because they do, due to the perch height that's present in parrot cages typically. And the wire dimensions may not be appropriate for their little feet either. And then chicken coops aren't appropriate for parrots because usually the materials aren't strong enough to keep a parrot beak from breaking out of it. And there also potentially could be some things that are toxic in there, like if maybe potentially some of the connections in some ways have any sort of lead, zinc, what have you, heavy metals that maybe the chicken isn't going to be so prone to pick at, but maybe the parrot is, could be a problem. So as you've seen in several of these pictures that I've put up, this is, you know, mostly it's been Artemis with my birds, and you can see that I have this picture of Artemis hanging out with my parrots. So if you want to have both chickens and parrots together, I mean, it's probably best not to have a flock of chickens around a flock of parrots necessarily, unless they're in two like totally different sort of stratas, like the parrots are up in something and the chickens maybe foraging down below and the parrots don't have the ability to get down to where they are. But like one single chicken, because that's all I have at this point is one single chicken around other parrots, what can I do to kind of have them safely being around together? Well, I can check the birds for influenza, and I said chickens because that's kind of where we worry a little bit more, but I can also check the parrots for that too. I can check the parrots for chlamydia, and same thing with the chickens. So I can test them for some of these infectious diseases to make sure nobody's carrying anything. We can also check stool samples to look for parasites to make sure that there aren't any parasites that potentially could go from more of the chickens to the parrots than the parrots to the chickens. Also, if anybody is sick, don't allow sick birds to mingle together. You definitely do not want your sick chicken hanging out with your parrot, you know, or the other way around. You don't want your sick parrot hanging out with your chicken. You don't want your sick parrot necessarily to be around your other sick parrot either. So like, it's just good biosecurity. If somebody's sick, that individual gets isolated, not around other individuals, washing hands, things like that to prevent there being spread of anything. And then super, super, super important, do not allow your parrots to be around your chicken's poop. Like, you know, chickens, their poop, that's where they have salmonella. Salmonella in their gastrointestinal tract. So you do not want your chicken's poop to be around your parrots. So what can you do about that? You can put diapers on your chicken. So here's a picture of Artemis having this one little diaper here, and she's kind of foraging on the ground underneath Arroyo and Maureen being on this little play stand here, but she's got this diaper on, right? So she's not making any messes in the house, and my parrots can't have any access to her feces. Here she is again, kind of modeling her little diaper, and here she is today modeling her diaper. So it's kind of silly, it's kind of goofy, but you know, it is a practical thing, trying to keep wastes away from the other birds where it could potentially be a problem. If your chicken wears diapers, you have to change your chicken's diaper as well. Not a glamorous thing, but part of chicken ownership, I guess, if they're indoors and around other animals. So, you know, my point is that you can keep parrots and chickens together, but you do have to be mindful in order to avoid infectious diseases and prevent issues happening between birds. And I purposely put this picture up because there's a picture of my dog in here as well. And not that it's a major topic that we're gonna, you know, get into further. Today's topic was chickens and parrots, but I put this picture up because, okay, here's my chicken in the back. Here's several of my parrots. There's Maureen on the ground, Arroyo up on a chair, Ema, my macaw back on a cage, and then Artemis just kind of hanging out on the ground, pecking around. But my dog's in the situation too. And I've met many people who are really afraid of having dogs and birds together. And it absolutely is not appropriate in all situations. Not all dogs can be around birds. I highly am aware of that. Dogs are predators. Dogs can be problems being around parrots, but every dog is an individual, just like every parrot's an individual, just like every chicken is an individual, just like every human's an individual. And some dogs can do okay around birds. And, you know, I think that we can mingle our parrots and our dogs sometimes too. It's okay, as long as we are being smart, as long as we're being safe, as long as we are, you know, watching out for any potential problems, issues, and if there are any things, you know, appropriately segregating, isolating, and preventing any problems. So, you know, with Artemis, she works out well to be around my parrots, but I fully recognize that that is not appropriate in all situations. And there was a point where I actually had more chickens, and Artemis hung out more with the flock of chickens, and at that period of time, I didn't really have my chickens hanging out with my parrots so much. It was more along the time when Artemis became a single chicken, and I decided I didn't want to add any more chickens to the flock at this point in time. So she's become a little bit more of a house chicken. She's indoor and outdoor, but in doing that, we tested her for infectious diseases, checked her out for parasites. She wears a diaper when it's appropriate. And I'm definitely observant of her interactions with the others to make sure that there isn't any chicken hierarchy problems occurring. So, maybe that was my last slide. Yeah, okay. So, chickens are fun. I hope everybody enjoyed the presentation. This is a picture of Artemis doing a puzzle with me. So they're great little companions. And I do think in the right situations, we can have them around parrots. We just have to be mindful of the way we are managing it. And if you have any questions, you know, reach out to your veterinarian and ask them, is this appropriate? What should I be doing? What's a problem in my area? You know, your veterinarian may say, hey, you know what, in this situation, it's not appropriate. And that's okay. You know, we just want to be safe for everybody. So with that, does anybody have any questions?
I have a question for you, Dr. Lamb.
Okay.
So you showed this fascinating x-rays earlier. Just going off of how you were saying earlier that chickens are so curious and they pretty much, you know, their curiosity sometimes gets the best of them as far as what they peck at and eat. If you were to take, like, let's say someone had an outdoor chicken and you were to take that chicken inside an x-ray, what would be the chances that you would find like kind of non-edibles, non-edible
Something.
items? Yeah. Like,
I would say there would be a good chance. That'd be an interesting sort of experiment to just do random chicken x-rays and see what you could find. I would bet it's a good percentage of them. I don't know what the percentage is, but I have to say, like, subjectively, we find stuff in chickens quite frequently that's not supposed to be in there. And I mean, they may not be even presenting for that particular problem, but we're taking an x-ray for something else. And we're like, oh, and by the way, your chicken ate X thing, you know?
Okay. So maybe like, gosh, I was just thinking around the Christmas time, like if you have an indoor chicken, like the tinsel, just like make sure you're
Yeah,
just,
don't have tinsel around your chicken, please.
just
That's probably a good thing to not have around a chicken, because they would love to just, you know, this weird shiny little thing that's stringy. Oh my God. They would love it.
they would love that, right? And then, so just going to, is there a difference among the chicken breeds that you find more, I get maybe you find more issues if they're more popular kept as pets, because there's more the chance that you'd see them more often than other chicken breeds, but.
Yeah, I mean, certainly like there's some differences in personalities amongst the different breeds. And I think because of those differences in personalities, there are some that tend to be more common as pets. Like I would say a good portion of the pet chickens I see are buff Orpingtons. They just tend to be really nice, calm birds, but also good egg layers. She's an Americana. Also Rhode Island Reds, you know, Australops. Those are some of the big ones that we see frequently that are nice birds who are more amenable to handling and not stressed living with humans.
Ah, and there's the silkies, the ones look like the Dr. Seuss
Yeah,
ones.
that's true. I didn't even, you're right. I totally blanked on
They're
them.
adorable. They look
The
like little
silkies.
fuzzy.
Yeah, people love the silkies, and the silkies are actually really sweet birds. Thank you for saying that.
And I'm at, so are most of the birds that the chickens that you see, are they hens as opposed to
Yeah,
like,
I definitely see more hens than I see roosters, but I do have some rooster patients as well. I should have put a picture up of my favorite rooster patient. He's the cutest thing in the world.
uh
His
and
name is Dale.
wow, okay. I imagine I'm just because I have no holiday no chicken experience, but I'm guessing that maybe roosters are a little bit more noisy than hens. Is something, is that
Um,
vocal? Is there vocalness that that I mean, what we most of us here know, like parrots can be quite vocal.
yeah.
Chickens, a different type of vocalness, correct? And
Yeah, different type, I would say. I mean, I feel like they're quieter, of course, because
okay, so is Artemis, does she wake up the sunrise with a
she does,
cock-a-doodle-doo?
no, she does not do it. She doesn't do that. No, she's much more subdued about the sun rising.
Okay, and just another, the perching. So like, I don't, do people not realize chickens perch, right? Do they like
Yeah,
to
they'll perch. Like at
get down on
nighttime when they want to go to bed, they usually go to roost, is what people will say. And so they want to sit on something high up. And so they will perch on a perch, typically, if given the option. But their perches aren't supposed to be too high, because actually if their perches are higher than what they should be when they like jump off of them, they just have a greater potential to injure themselves in some way. So usually people say like maximum of 3 feet is best for perch height on a chicken.
And what would be like, if you were to equate like Artemis's perch size with like would it correlate with a certain size of parrot, like as far as a perching option goes to
Oh,
correctly? And should it be a
I
variety of perching surfaces, kind of like we do with our
yeah, variety of perching surface is good. A lot of people will in the like houses, like the hen houses that are available, may have like either wooden dowels or cube sort of perches, you know, so it's like a square as opposed to like fully rounded, like it's more square. And I would say like she has a square one in she has a couple different houses. And one of her houses, she likes to just sit on the top of the house. Like she jumps on the top of the house and that's where she wants to sleep at night. So I let her sleep up there. But the other house that she has, it has more the square perch. And that is probably like maybe 2 inches by 2, like 2 by 2 inches on either side. So
okay, and because they have different their feet, chickens have 3 forward, 1 back, and parrots are 2 forward.
yeah, there's her feet. If we can see there.
They
So
do have significantly larger feet proportionally than birds, than parrots, it seems like. I don't know, those look like really big Yeah. And wait, what are there? Sorry, I'm fascinated by chickens now. Are their feet do you refer to them as their feet or their claws or what when like
I
talons?
mean, I still call them their feet. Yeah. I mean, sometimes you'll call the toenails like the little talons, some people will say, but you can just call them the nails too.
Okay. And do you have to keep those filed down or do they overgrow their?
Most of the time, most chickens are keeping them fine on their own because they're running around on the ground all the time, right? Like since they're not really flying or anything like that, like with them running around on the ground, most chickens will keep their toenails appropriately trimmed. But sometimes, for some lazy girls or girls who live on pillows all the time and don't have to do much, they may grow their nails a little longer and thus need some grooming, just like our parrots.
Okay. All right. Well, that was fascinating. Thank you. And thank you, Artemis, for being such a great chicken
Yeah,
role model there for us.
right.
And so we do have, let's see, I have a couple announcements. So next Friday we'll be on with Dr. Tom Tolley for an episode of Ask the Vet. And okay, and I have to announce today's giveaway. So that's going to be today's winner is Victoria Neubauer. You're going to be sent out the pumpkin spice Nutriberries. Just by the way, they were so popular that Lafeber's extending that out to December 22nd. So you can still order those through December 22nd. That as well as another Lafeber product of your bird's choosing, which could be booster berries because we have a chicken booster berry line of products. So um, and then of course we've got our insanely popular fun webinar coming December 20th. That's going to be our holiday giveaway. It's your chance to join us and win. We're going to give away all the products and prizes that you see. Lisa Bono is going to walk us through some fabulous must-have bird products like toys, jewelry, swings, Lafeber products. So you got to join us. Tune in. That's going to be on December 20th. And then, oh, and also, if you might have noticed today, so Dr. Lamb is joining us an hour earlier than usual this time of year. So we start Dr. Lamb's webinar is at 11 a.m. Well, and California time. I'm sorry. What time is it? It's because we're doing it. Yeah. Sorry, my time. I'm sorry. An hour earlier than we usually typically do. Because it's the changing of the clocks is kind of yeah. So
Yep, Arizona does it different than everybody else. Sorry.
no, we appreciate this because we know you do this during your busy, busy clinic days. So I totally appreciate it. And yeah, so just want to say that. And excellent. And thank you for walking us through that. That was really fun and informative and a new appreciation for chickens. And now we know that how we can safely keep them indoors with the little type. That's awesome. So
All
all
right.
right, guys. Thank you for joining us. We'll see you back in, I think, is it February? When do we see you again?
Yeah, February.
All right. At 11, I'm sorry, an hour earlier in February with Dr. Lamb. So
Right.
special time. You get our special time because we get your special attention and fabulous presentations. So appreciate it. All right, guys. On that note, have a great weekend, everyone. Stay safe till next time. Bye.
Bye.